If you want the lower teeth to be radiographed, then the principle is the same with one exception. We use this direction for the upper incisors. Now we'll flip it down 180 degrees and we will just use the other. See, 1, 2. Now this is for the central incisors and you ask the patient to close. And this is how it looks from the side. See, tooth, film. Here there is a chance of a bit of slanting, malpositioning of the tooth and the film. So you have to compensate for this angle by directing the beam to the angle bisector between the tooth and you have to direct. See, this is the tooth and this is the film over here. There is an angle, not like in the upper central incisors. You direct it perpendicular on the tooth. Here there is an angle. So you have to compensate for this and you will direct your beam not perpendicular to the tooth, not perpendicular to the film. You will direct it perpendicular to the bisector of the angle that has originated between the tooth and the film. Okay? So, instead of directing the beam, let me show you from here. If you direct the beam perpendicular on the tooth, you will have an elongated image. That is reduced vertical dimension. If you direct it perpendicular to the film, you will have a shortened image, and this is increased vertical dimension. So what you do to guarantee this, you direct the beam perpendicular to the tooth first, direct it perpendicular to the film second, and then direct it midway. By so doing, you have directed the beam to this angle bisector, and this is the principle of the angle bisector technique. 1. So this is elongated image, foreshortened image. So this is the almost correct image. Once you direct your beam to the angle bisector. Second thing is that where to direct your beam. To direct the beam for the lower central incisors, this is the tip of the nose. We used it for the upper central incisors. If you extend the line down, this will be your reference point to the lower central incisors. Okay, so it is the same with the extension. To prevent concutting, as we agreed earlier, for the upper central incisors, this will be flush with the, after you guarantee your correct angle, directing it to the angle bisector, this will be flush with the cone, so that you will not end up with cone cut of the image. If you want the canine, then which tooth of the tooth will be in question? In this case, the canine. You will place your sensor behind the canine, exactly. Ask the patient to bite on this slot. Okay. This is used for the patient. You use it for the patient to bite. Okay. So canine, and then ask the patient to bite. Okay. And this is how it looks from the side. Tooth, film. So again, there is a slight angle here. Where will we direct our beam? Again, the same reference point, the lateral border of the ala of the nose. Here it will fall on the upper canine. Extended down, it will fall on the lower canine. So it's the same reference point. Now, let's see where will we direct our angle. Perpendicular to the tooth, elongated image. Perpendicular to the film is a foreshortened image, so you direct it to the angle bisector. That is midway between both extremities. To prevent concut, then I will just make this flush with the upper border of the outer border of the position indicating device, or what we call the cone. Okay, very easy to use. So take this out once you're done. Ask the patient to open and then remove the the film out of the oral cavity.